We started with 12 people. 12 people, 25,000 square feet, and looked around and said, what have we done?
Now we've got more than 4,000 employees, in 2 continents and across the U.S.
Our goal for IKS really now is, backed by the courage of conviction of our success to date, is simply 3 words: impact at scale. So we anticipate 40, 50, 60% growth for the next several years, perhaps a decade. And if that's going to happen, highly likely we go from 4,500 employees to 50,000 employees in the next 5 to 7 years.
We can say with some pride that many of the top 20 or top 50 hospitals in the United States are our clients and our customers.
My partner and I like to joke that we didn't start IKS for good jobs, we left good jobs to start IKS. Our mission is to revolutionize care.
We are changing physicians' lives. Now, how are we doing that? I think the most important commodity in a physician's life today is time.
Physicians in the U.S., over 50% of physicians in the U.S. are burnt out. The expectations are too great and they can't focus on patient care like they've always wanted to.
Many physicians get huge number of prescriptions every day that need to be screened before they're sent again. Big impact on patient safety.
By centralizing the work and delegating it to IKS, we've managed to reduce the work of our nurses and MAs 64% in regard to medication renewals.
They have the freedom to practice, they have the freedom to connect with their patients, they have the freedom to have a life outside of medicine.
It used to be that the doctor's world was all about the doctor doing the work. And today, the sport is no longer a solo sport, it's a team sport. And we need to bring in team members to help the physician, the provider, do the work that they need to do.
Currently, we are looking for professionals for financial services, technology services, and clinical services.
And I'm really looking forward to welcoming many of the bright, young, disruptive technologists that want to come and be a part of this mission, because as you know, healthcare, there's been a lot of technology written in healthcare, but the biggest problem has been that it has never really fundamentally helped the provider and the patient.
I've really been impressed with the leadership of IKS. It's healthcare the way that it should be done.
To me, the difference that IKS brings to the table is the IKS people. They are among the highest quality, most fastidious, thoughtful clinicians and team members that I've ever worked with.
The great thing about working for IKS is you get to be a physician who's actually supporting physicians in one of the most advanced countries in the world.
Do we make it a better place to work? A big part of our mission is making sure that we bring joy to all.
I'm a part of IKS.
I'm a part of IKS.
I am invested in IKS.
I'm a partner with IKS Health.